Good morning, everyone. It is Monday, September 13th, 2021, and welcome to Perspectives. Wherever you are from across Grenada, which includes Carriacou and Pity Martinique, of course, we welcome you to the broadcast. I'm Brenda Baptiste, your moderator, and we're here this morning, in a kind of somber mood, but nonetheless, fresh perspectives and trying to get through as best as we can. It's a beautiful Monday morning in terms weather-wise. It looks really, really great on the outside. I'd like to welcome and thank everyone joining us on the various broadcast platforms: MTV On Air, online, Mikey Live, TNR Communications, Partygrenada, our own Perspectives page, and TNR in Carriacou. Good morning. Not TNR, Sister Isle in Carriacou. Good morning, everyone, and welcome. And we say good morning to our expert talk panel of Senator Christopher Allie, who's here in studio with me, and Mr. Byron Campbell, who's joining us virtually this morning. Good morning, gentlemen.
Good morning, Brenda, and good morning to all our viewers and listeners. It's a pleasure to be back here, at least safe, and in our country that is now challenged with COVID in various forms, hospitalization, deaths. But before I say anything, I want to extend our sympathies to a good friend of mine who I was told yesterday succumbed, that is Andy Hostin, and of course to the entire Hostin family, and to all other people and persons who have lost loved ones. Our sympathies go out to yourselves. And just to say to our Grenadian brothers and sisters, we are in a difficult period, and we need to, at least try and keep yourselves safe. There is another side to it, Brenda, that I want to probably stress is, the emotional and that side, and dealing with the psychological issues that is going to come with the deaths and with our loved ones getting infected and seeing them suffer. And it takes a toll emotionally and otherwise. And for those of us who have access to services where you can get, some relief, talk to a friend, even though it's virtually on the phone, speak, express your feelings and so on, because that also is a significant part of the COVID crisis. And it's just not only the physical and the physiological, there's also that emotional and mental side that we need to address as well. So just to say that, please have discussions, chat to your friends, your loved ones, and keep it going. Sometimes a conversation is all that is needed. So just to say that. Outside of that, Brenda, on a positive note, I spent my lockdown weekend tending to my garden and doing all the good things that I had postponed. So I planted soil, albeit some people may say late, but I did that and cleaned certain areas, fork up certain aspects of the land. I was having fun.
Yeah, you said it's kind of tending to my garden. There's kind of pomp as if it's some kind of big time garden. You're a big time farmer. It's a big time thing. Okay.
I haven't done it in years.
All right.
Again, my good friend Byron is not next to me this morning, but we're here virtually. He's a good influence.
So he say you have a big time garden. That's true. Have you seen it? Because you're qualified to kind of, say what is a big time garden. Mr. Campbell?
You must put some smiles on the face. Byron?
Good morning all colleagues. I miss you all this morning physically, but as I told you earlier on, I'm having coconut water and fruits while you labor at your studio.
Very unkind.
Very unkind.
Very unkind.
And Chris, you're framing up to be some kind of farm of the year to reach you. That's a positive thing. I congratulate you for that, but seriously, I want to endorse your comments, in terms of sympathies, condolences to the messages to the families who have lost and continue to lose loved ones. We're not in a good place. This is not where we wanted to be. This is something we spoke about over and over and over. The question is, again, not kind of blame, but how we attend to this. I just want to focus on a little bit of numbers here, Chris. Before I do that, let me say that I want to also congratulate and, as you say, big up all the volunteers that is working. And I want to mention, because even like from my office, our driver is work on the weekend transporting medical staff. I just want to mention that looking at the numbers, I see some 577 persons who are vaccinated over the weekend. And that's a good thing. It's a good trend. If we could keep these numbers up, all these pop-up vaccination centers, excellent. But what does the numbers look like? When I look at it, colleagues, that I see that some average of 3% of the persons infected being hospitalized. And I see that out of persons hospitalized, some 30%. That's 3 out of 10 persons are dying. I mean, that's the numbers that we're working with. This is what the numbers show, and we've been averaging about 200 registered infections per day. So it's important to analyze those numbers, see the trend, because ultimately those numbers, the science is what should help in terms of guiding the restrictions and protocols and other factors, you know. But we're not in a good place, colleagues. Morning.
Yeah, I think.
Certainly, Byron. We averaging 1,000 cases a week on average thereabout, and the minister did allude to that the last time, that it's going to get worse before it gets better, and I suspect that's where we're heading. In order to flatten the curve, we don't even know if these lockdown procedures and what will be the outcome of it until probably 2-3 weeks down the road. So, you know, as we strive and try to do our best, and we've seen a lot more positive cases across businesses, you know, across every aspect of the society that we know. Every day we're hearing about friends. And, you know, this is the thing about the deaths, Byron. We are such a small country. All of us will know friends and people who have died or succumbed to COVID. And that is the part that, you know, what over the last few weeks and months we've been trying to say to folks, we don't want to get to that point. We want to get, you know, keep what we had, and please vaccinate so that you could reduce the amount of severe illness and inundate the hospitals. There's the other aspect of people going to hospitals who have strokes, not because of COVID, but other illnesses, and can't get the kind of treatment that they would want to, because the hospitals are so occupied dealing with COVID cases. And that is a serious aspect that, you know, we keep forgetting. And then there's the other major thing that I think that is impacting is personnel. What we're hearing about nurses and doctors and police and so on being, you know, succumbing to COVID and getting tested positive and can't work is putting a lot of strain. I mean, you hear a lot of things about people personnel at the hospital, and they're very thin, or, you know, they can't, how many nurses on a ward, 1 or so or 2, you know, you're not sure if all of these are true, but the point is, most of these frontline workers are so heavily, you know, worked out. A lot of them tired, working enormously long hours, and, you know, it is becoming a situation. I was told that, you know, quite a number of them who have tested positive and have to be isolated need some assistance. You know, we're trying to do care packages for some of them, and so our frontline workers, in short, is extremely pressured and stressed in this situation, and it continues to apply pressure on all aspects of the medical services.
I think it behooves all of us, though, to lift the conversation, lift it in the way we talk to them, we talk about them, and more importantly, in our actions. Because I find we're saying on one side of our mouths that they're so important, they saw this and they saw that, and then after working 32 hours, they might take a break and say, let them go to Facebook. And there we are bashing them and having the worst things to say about them. So we need to make up our minds what they mean to us and who they are to us. And it may not be you or I saying it, but at the end of the day, that is what they are receiving, you know, after giving, you know, of that kind of service. And somebody might say, okay, well, that's what they signed up for. Yeah, we understand that. But before anybody signs up for anything, the nurse, a doctor, you know, the person, the ambulance, the orderly, the whomever, they're first a human being. And so I mean, this last week in particular, we've just been going, because it's almost as if you figure people are so anxious and pressured that they have to find something to cough or to bounce. They just can't relax, you know. And so they have come in for a lot of that incoming ire, and we need to take a look at that. So we keep saying how, frontline workers, yada yada yada, yay, ray, and then on the next side, there we are going in at them, and you know, we can say what we want. If you people who's calling in on radio programs or posting on Facebook, and they went to the hospital and this happened, but the hospital, not many people are going to the hospital. So where did they see that? Where did they hear that?
Yeah,
so we need to manage that kind of, because we have for once, let's just put aside our little things, because there are bigger issues. So let's focus on other people who really need our energy to help.
I think, Brenda, that's an excellent point, the human side of it.
Yeah.
And we tend to ignore that, and regardless of what we see, our nurses and our doctors, the orderlies, everybody, the ambulance
And what I
drivers,
told you is a real life situation. On Saturday, I checked in with a nurse who's a friend. And I say, how you doing? I won't hear nothing about COVID. How you doing? She said, girl, watch, give me a chance. And then she just started to bawl. I mean, literally bawl. And, she is like, she's not even feeling herself. She feels numb because she just keeps going and she can't stop because she is needed everywhere. And she loves what she does. She loves nursing. She loves the profession. She's just she's just a generous in heart and spirit and in everything, And she said, girl, Brenda, you see all of them media people, and she started to cuss me. So I said, I am Brenda. I'm not no media person. I'm your friend, right? And she started cursing me. And that is why I brought up the story, and she was saying, stuff she's heard. And I said, people sending things to her phone, send her a prayer. Don't send them nothing to their phone. Don't screenshot nothing. My earring fall. Don't screenshot nothing and send them. And send anyway. My earring and all chat with the nonsense. Yeah, don't screenshot. Thank you, Senator Allie. Don't screenshot nothing and send. Somebody at home laughing. Yeah, we need to laugh, right? Yeah, don't screenshot nothing and send them. Screenshot a prayer. Screenshot a thank you. Screenshot I love you. Screenshot I am here for you. Screenshot I am lifting you up. We're in this together. Screenshot the flag. Let's do that. Let's do that.
So Byron, let me just shift the conversation to you a little bit and tell me what you thought about Gaston Bong's mandating. But go ahead with your commentary.
Do we really want to talk about that? Yeah, go ahead.
No, it's happening in Antigua and Guyana.
Yeah, it happened there.
Chris, I wanted to, in fact, because I know you are an advocate for mandatory vaccination in some sectors, and we see what's happening around the region. What's happening in St. Vincent, particularly in Antigua, the government there is taking a strong position. In Canada, in the US, we see around the world, various governments are making it mandatory for testing for certain classes of workers, certainly government workers and other essential service workers, those interfacing with the public. Clearly, and they're putting forward the statistics, the evidence to show that it makes a difference, So the question is, even the assessment we had here from the regional expert in terms of a position paper for OECS governments. And this is something to look at closely, I believe, and the question is, where is labor, NGOs and others in terms of discussing this important point. So I wanna, and I'm looking forward to your comment on this going forward, but I just want to make one point to pick up where Brenda was. We are not thinking much about the psychological impact on everyone, on a lot of people, in terms of the impact of the COVID pandemic right now, particularly as people close to us die and are dying. And I just want to point out that I was speaking to one of the classmates of the young student who died last week, and she is still in a bad way. And there are other students. In fact, we have, and on the project we have, is organizing counseling for all support staff, because we have field staff and other staff. So we need to keep that in mind. That kind of support is very important. This is new for us and how we deal with it. And the other point that Brenda was making related to, misinformation and just outright nonsense and all these theories and all that is dominating social media right now, and people are believing this, and that's what makes it so dangerous, and how do we counter this? How do we people don't fact check things, they just pass it around, and we're vulnerable and we believe and so these are issues that we really bothers me a bit. But Chris, back to the mandatory vaccination. How's it going? How do you see it? How should it be approached here?
He's sitting here getting all excited. He's
No,
getting all
Byron,
excited.
I
Whenever
mean-
somebody say mandate, it's almost like an
No,
orgasmic reaction.
When you see what is happening in Guyana, in the south, for example, Guyana have mandated that you can't go into a public place like government services unless you're vaccinated. They have asked for all the civil servants to be vaccinated. Even to banks, they're saying you can't go in unless you could show your vaccination card. They have gone really extreme. And then you have, to the north of us, Mr. Gaston Brown announcing that, his cabinet took a decision that all public servants have to be vaccinated. If you're not vaccinated, you have to be tested and show your results. And if you don't want to do that and you go home after a while, you lose your job. So there are a number of us in the Caribbean, or Caribbean leaders are seeing that there is a necessity to mandate for certain sectors. And I want to be clear on that. This is not mandating for the entire population. I have always supported mandating for, and I've said it before, security forces, nurses, doctors, the people who are in the front line and are expected to hold us firm in a COVID crisis. Security is critical, medical, public health is critical, even essential services, airports, ports, and so on, customs, immigration. These are essential aspects of our society that need to hold firm, even though we want to balance, as we balance livelihoods and lives. So we must, in my view, have a situation where the protocol for these particular persons must be different to John public and the general population. That has always been my view on mandating. I am not in favor of saying, as Chester Humphrey had said one time, pulling you in a van and shoving a needle into your hand whether you want it or not. That is not what mandating is for me. I am saying that we must identify critical aspects of our society where I think it's a requirement. And I'm not even saying our whole public service, because there are a lot of back office people in the public service that are not exposed and so on as normal as Frontline. And of course, you can decide what you want, but the issue here is I think that we need to, and as this crisis in Grenada develops to a point where the CDC have now listed us, I think, number 3.
Level 3.
Level 3, and that carries its own issues. We have flights coming in from the UK. Just now they may put us on the amber level, and that will have consequences for travelers coming in and out. So we need to get a quick control of this situation, as quick as can be. But we know, Byron, once we have community spread and this Delta variant, and recently the MU was identified in Jamaica to a significant amount.
In St. Vincent.
And St. Vincent as well. And look at how close St. Vincent is to Grenada. So you have to be very, very concerned that another variant may enter our environment with even the controls that we have. And the MU, apparently, there's no vaccine that works against the MU so far. So, with all of these developing and evolving situations, we cannot, constantly beg our people to be so careful, follow the protocols properly. And this word properly is important. Follow the protocols properly and vaccinate as much as we can to keep this situation with the mutations at bay as much as we can. So, I don't know what else language to say it, but more than to say that we have to keep trying every day. And it's not about commanding and threatening and coercing as some people, so it's about constant conversations.
Right.
There are a lot of us who are on the fence, and probably we can get them over, and we need to constantly keep chatting with them.
You use the term developing crisis. I don't think we have a developing crisis. I think we have a crisis. In the sense of what is happening in Grenada. And speaking to, your call and your point about the mandating for Frontline and the necessary services. It's been proven. In a police complement of just over 1,100, we have 100 and close to 70 positive COVID cases. And now we have other aspects. Remember, in a state of emergency, the main driver of the state of emergency is the RGPF. So having 160, 170 plus of their men positive And then remember, of that 170, let's say you multiply that by 2 or 3, there will be some we would have to isolate. So already their complement of men is compromised and so on. And I see people making jokes about, it's not a joke. Whatever you're trying to say, that now the police is sick, so now is the time for whatever, it's not a joke. And I think if any of those kind of conversations are captured on social media, the RGPF should treat it as a threat, and the public should report it. Because, I mean, we just have to manage how we behave. Our behaviors have really slipped to an all-time low, and we have to manage it. We just have to manage it. We cannot continue to slip down into that abyss of nothingness. We really have to manage how we behave. That's not a joke that the police are now compromised, so let's do this, or we could do that. No, those things are not jokes. Even if you think it, maybe think it and laugh for yourself, but don't put it on social media and so on.
Just to add to that, Brenda, this is not a time for blame game and division. This is a time for
support. Well, we keep
support.
saying that with one mouth and then we say in another. We keep doing that.
That's why I want to reinforce the point. This is a time for support. Support all the frontline people, the police, whoever. And our support comes in various. We don't have to be on the line with them, but we just have to give them the support. So, for example, the police and your behavior points. We need to adjust our behavior in this crisis, and that is supporting the police force. You know, saying care, not posting nonsense about our nurses and our doctors, but just giving them support, positive support. That's support. We don't have to be on the front line with them. Make them feel good for the sacrifices they're making.
I mean, look, we lost 2 doctors last week. Dr. Varma,
that's what it's about.
I mean, I saw so many people saying, and that was a poor people's doctor of the West.
The young man.
Dr. Varma. Dr. Varma moved to
Dr.
Grenada from India.
He operated more in Sept.
Correct.
That's right. I didn't know he passed.
Right. Yes, he did. Dr. Varma passed, and of course, the young Dr. Ray, he passed as well. And that's the thing. When my friend was crying on Saturday, she was very close to Dr. Ray. So she had people she's seen being compromised, going to homes where she's finding old people compromised, and then losing her friend. So she's running the gamut of emotions. And I asked the question, I said, okay, I know it's COVID, but who's hugging you? Who's telling you it's going to be okay? What is happening on your end in terms of that sort of emotional support? And that is something we have to address immediately. Immediately needs to be addressed. Because if she's in the eye of the storm and she's one of the soldiers in the front line of battle and she feels like that, then we know we could multiply her by 100. So these are some of the things we have to pay really, really critical attention to. You know, we have to pay attention to it. I mean, we lost so many people. Last week was really, really hard for me. And, you know, I just want to try to grin ever soften this morning because I don't want to lose my composure.
I'm going to hug you.
Have my mascara
when I put on
running.
my mask and so on,
you go hug me after, right? Thanks, I need it. Right, but it's just more and more of that.
You can't hug nobody, Byron.
And then yesterday morning you wake up it's yesterday morning, you wake up and there you see, you know, this beautiful image of this towering Grenadian woman that was so full of life, gave so much of herself, a mother to many, you know, Mrs. Merrill Forsyth. May she rest in peace. Such a beautiful, generous soul, all about country, family. Just a really beautiful woman. She's gone to the great beyond.
That slipped me to mention sympathies to the Forsyth family. I mean, Merrill and I became very good friends through mediation. She was one of the originals with us, and I learned so much from her. I mean, as everybody said, she was such a calm person and, you know, a motherly figure. And, you know, it's just those are the things that you will miss, people that you will miss, you know, as they transition. And that is something, and you know, Shamara and all of her close family. I mean, it's just, you know, it's just one of those things again, but boy, it's becoming difficult as we see
and
friends.
I mean, Mrs. Forsyth's illness is not anything. It's not COVID related at all. But just in the heart of all these things that are happening, And then Rihanna Bruno, that was one for me as well. Rihanna, I moderated an Emancipation Day panel, and Rihanna was the youngster on the panel on reparations. And her analysis of a situation, her nuanced views on things, it was just so progressive and revolutionary. And I felt so good, being in the presence of someone like that on that day, looking at her as a future leader of Grenada, and just someone at that age who was so mature and could, pick up on things in that way, and was so in love with history as well, because you don't find that's not very common among young people, that love for history and that kind of, how they can put the history in perspective as to what's happening now vis-a-vis back then and so on. And she brought that to the panel, and that really got me last week, Her and Dr. Ray really shook me up a lot, especially Rihanna, because after the panel we had promised that we would meet up and have a conversation and so on and do other things. So my deepest condolences to her mom, her dad, the TAM CC community. She was well loved by students and lecturers alike, and everyone else over there, her friends and family, her St. Joseph's Convent family, teachers and everyone. And may her soul rest in peace, and may her beautiful memory live on in our hearts.
So Byron, what were your thoughts this weekend on all the hoopla they were making about the ethics committee? I saw a lot of things going on, comments and so on. The newspapers had it, newspapers blasting it and so on.
That's an interesting point, Chris, and because you recall last year in the United States in particular, because this was often on CNN, where they were talking about doctors and medical staff having to make decisions in terms of who, with the limitation of medical supplies, who would be served. In other words, they had to prioritize, and they spoke openly about being able to prioritize that the hospital services were inundated and they simply could not treat everyone. They were begging for volunteers. That wasn't their major wave. We are in our major wave at this point, and what I suspect is the authorities were analyzing the situation, how they're going to live, how they're going to deal with this in terms of our preparation. Looking at this, they didn't want the medical staff to be engaged in these kind of decisions. So my sense is that putting together a group of persons within the society to be able to discuss and analyze those decisions before having it strictly to medical staff. That's my sense of it. So it's not something that's been done, but something that's been contemplated. So it's been done before. What is the approach? If you anticipate that your facilities, your medical facilities, your oxygen, your incubator, not incubator, sorry, but your
ventilators
systems are going to be limited supply. How do you prioritize? How do you decide? Ideally, you want everyone to have best medical care. That is a fact, and that's what you want. You don't want to compromise on that. But in planning going forward, what do you do? And I suspect this was an opportunity. Maybe how it was said and how it was understood initially by the public is what created the problems. That's my sense.
Well, my take on it was a lot of people felt that the minister should not have mentioned this. We're not sure the composition of the committee, but I know generally in the medical field there's this principle of triage, and doctors have a protocol as to how they operate in terms of who gets treatment based on severity and the nature of the illness at the time and so on. Yeah. And probably some people felt that should have been left for itself, and let probably this ethics committee come up with a protocol in a COVID environment for the medical fraternity to operate under. So I am of the opinion that it is a reality. It is something, as our hospitals get inundated, you're going to see priorities be given based on what you say, constraints with medical equipment, constraints based on age, based on all of these things. You have a 95-year-old versus a 25-year-old, and there's an issue with ventilation. Who do you give the opportunity? And that is, that is a brutal thing, as we know, all lives are precious. But at the end of the day, these type of situations and crises will cause us to go along that way because we are all constrained by the resources. There is no medical facility in this wave or in this crisis that will not be inundated. And that is something we have to put our minds to. And thinking about the doctors and the nurses, it is not a decision, a nice decision to make, but it's part of the profession.
Yeah, and I think that's
something that
that's
they
where
do all the time.
that's where your review boards in those medical facilities, that's where your review boards and your ethics committees and so come in.
Correct.
And the ethics committee bit probably sounded very strange to us as we are in this very sensitive time, and very sensitive and volatile time. So anything as it relates to life or death, anything that relates to speaking of life or death, coming from the mouth of a minister or whomever, is probably received in a particular way. But just so we are clear, ethics committee is not something that came out of the clear blue sky of Grenada. Remember when COVID was in its, when they were having the wave in Europe, and a doctor friend of mine reminded me of that only yesterday. She said, Brenda, remember when we were having the wave in Europe and we saw all these people in Italy dying, all these old people? She said COVID wasn't only hitting old people, She said their hospitals became so overwhelmed that is the decision that was being made. That's what their ethics committee was doing. That is what the people who govern the medical ethics over there, that's what they were doing, deciding, who's more compromised. We can't do nothing about, is it a 97-year-old or is it that 40-year-old that have a chance? That is what was being, that was what was happening in Italy. And it's everywhere. But, for us, we're evolving and many things are happening. And I do believe that everybody's coming from a good place. Because even in the Prime Minister's address of, not the one before he went off on vacation, the one before, just around the 29th thereabout, when he started to ask questions of the nation, when he was kind of telling us, calm down and settle down, and this is where we're going, and this is what could happen. He asked the question, do you want it to get to a case where you have to go to the hospital and the nurses and doctors decides who lives or dies? He entered that into his speech. So it was saying as well that if we become so inundated and if we become so overwhelmed, that's a functioning arm of medicine that, and those decisions would have to be made. But as I said, in a press conference, a question is asked, a minister gives an answer, people are dying, your mother's sick, your father's sick, things are happening, and already there is this thing associated with death and coming from whoever lips. So it is just, taken in that way. And then I saw no media except Now Grenada. No media went into explaining what is an ethics committee. Right. Is this something that can happen? Where are these things practiced? How are the decisions made? I saw no media educating the populace on ethics committee. All I saw was the run with it. Yeah, and when you see the headlines, you had people in New York, what going on in Grenada? What's that? And I'm like, hello. You have the same things that you have the same thing at Kings County. Yes, true, it's true, Brenda. Yes, that's what's happening. I say, so what are you angry about? Yeah. She said, well, I read the paper.
Sensationalization.
And I'm like, that is the kind of thing. That is the kind of thing. And you get to a point where you have to wonder, is this deliberate? Is this training? What is this? I mean, yes, you have to report it. It is news. It is news. Don't make no mistake about it. It is news, but let us go all the way. Let us go all the way with it. So our people understand, all right, this ethics committee thing, so who picking this committee? Minister Steele? I don't think so. And let us do that kind of thing, and let people know what is happening. But we're just going all the way in on nothingness, and we're just coming up with more pain and extra baggage and all the other things what we have to deal with. It is quite a time for us.
Well, what we have to keep in mind as we have this conversation and this is happening is that we are in an emergency. we are in an emergency. This is not normal times.
Yeah, there's
In an
another E word
emergency,
too, emotions.
Everything changes.
Emotions and
Everything changes
emergency.
in an emergency.
Yeah.
If you look at what happens in the military during a wartime, the same thing operates. It's an emergency, and decisions have to be made. Even when normal times when you go to the emergency, the casualty, when you go there,
Yeah.
you sometimes things and you're waiting, and you have to. The medical staff is determining who comes in, and you might say, "Well, I've been there first. I've been there before, waiting." But they're making decisions of a similar nature in terms of determining how to
Severity of cases.
Severity,
Yeah.
Even an accident, it's a bus.
That's a triage principle.
And this is not business as usual. And we will see new systems, new methods, new procedures emerging as we go. Because we've never had this before. This is new to us.
Yeah, because doctors will tell you, that that's the Hippocratic oath. Do no harm.
They do that. That's
do
a daily
no
thing.
harm. That's what it is. And so they do their best to take care of everyone. And no one should ever come away with the feeling of that they will just choose, okay, you go dead. No, they don't do that. They do their best. They do their to the end. They will go to try to save a thing. But we just don't want a situation where it's inundated. And so these difficult conversations and these tools of management have to be entered into the conversation. One of the things as well that troubled me this week, gentlemen, this is a very difficult one, but it has to be addressed and it needs to be said. So I am going to say it. We're having a situation at nursing homes and convalescence homes, old people's homes and so on, where staff at those institutions some have chosen to get vaccinated, some have chosen not to get vaccinated. But what has happened in Grenada is that the actions of some have created situations of death in some of these homes. And that is regrettable. And that is something that needs to be addressed. All right? We're having cases where if you have 8 people in working at a home and 4 vaccinated and 4 not vaccinated, you are really risking the lives of the elderly at the home. I think the boards of nursing homes, the management of nursing homes, at this critical juncture, have to take a decision on staff at the nursing homes who are not vaccinated. If they want to sit it out until whenever, but for now, I really believe it is risky, very risky, Senator Allie, to have staff who are unvaccinated to be caring for older folks at the nursing homes. I really think that we need to take a serious look at that. Folks have passed, older people have died, and we have to, it cannot be, and that is where, it speaks to people like your point with the mandating again, because my personal choice not to get vaccinated impinges on a person who can't help themselves. And my personal choice actually could cause the death of an individual. So this morning, in the most loving way that I can, boards of nursing facilities, old people's homes in Grenada, boards and management, you need to take a decision on staff who are unvaccinated.
Brenda, we have examples of this in New York, for example, where they had major outbreaks in convalescent homes and those types of caregiving facilities that, decimated quite a number of elderly folks who, as you said, can't help themselves. And this is a situation that we need to constantly keep looking at. And I 110% agree with your position. We cannot take these kind of risks to elderly people who, just don't have a choice really. Because if you come in as an infected staff member and you infect 3, 4, 5 people and generally in those homes it's confined spaces.
Yes.
So the possibility and the risk of developing a super spreader within that home is so great. And, if staff members believe that they don't want to be vaccinated, well, you have to take a decision and live by that consequence of not coming to work. Or as you say, the boards need to make very firm decisions on the way forward. And that is something I fully support, that, we must protect our elderly as best as we can. We can't just throw them on the side and ignore.
No,
and that is something that we have to pay attention to as well. And I so agree with you. I don't think it's controversial. I think it's a situation where, we always profess to be a Christian nation and following Christian principles. And one of the best Christian principles I know is that you have to look out for your neighbors, you look out for yourself. And if we want to do that in this crisis, well.
Support Brenda's view here. It's a very strong position. And keep in mind that these homes that we talk about, they're small. It's very difficult to self-isolate anyone there. It's not that they have separate rooms and so on that you have in the US and other developing countries. It's very much, in a lot of cases, open kind of wards, and a lot are very small. I've been there. So it's very difficult to self-isolate once you have infections in these facilities. So it's very important. I think vaccination becomes a critical and necessary procedures. And this should be immediate.
Yeah.
So Byron, I know we're closing, and I know Brenda will close the segment, but I'll leave in something with you.
Yes.
And probably we could discuss it on the next program. What do you think about our elections for the Olympic Association? I'll leave it right there.
Nah, Chris, you can't leave that. This is too important.
Yes.
I know we're closing the section now.
We had elections?
Let's leave it there, but it raises a lot of cause for concern. I mean, really, and remember when we were talking about this, I was saying that it will come down to the affiliate members, the membership, to really do that. And I'm disappointed. That's all I was saying.
Okay.
Right. We take it up on the next program.
Yeah, you pick up your disappointment on the next.
It is democracy in full force.
Right. So we pick up your disappointment on the next program. We need to take a break and come right back as we have the Minister of Health, the Honorable Nickolas Steele. He's waiting in the wings, as we are well aware. Many calls on his time. And he's here to provide some information and for us to ask him some questions this morning. So we have to do that. We take a quick break and we'll be right back with our Minister for Health, the Honorable Nickolas Steele.
Get Vax. It's your best shot. Hello.
A message from the Ministry of Health.
Are you gonna wear your mask today? You see everywhere you go, there are rules you got to follow, so don't you say COVID-19 will delay. Take the opportunity to save your community. Don't be that guy, put a mask on your face if you're heading outside. It's your life, my life, more lives will be taken if we don't try. If you feel any symptoms, call the hotline. Stay inside until you feel fine. 6 feet away every day. Keep COVID-19 far from away. Keep Grenada safe. Be COVID-19 smart.
Welcome back to Perspectives. If you're just joining us this morning from whichever broadcast entity carrying us, we welcome you to the broadcast. And here with us this morning again, it seems like a Monday morning ritual, is Minister for Health, the Honorable Nickolas Steele. Good morning, Minister.
Good morning, Brenda. Good morning, Byron and Chris. Good morning to all of you.
Morning, Minister.
Good morning. Good morning. How was your last 72 hours?
It's been difficult and trying, but there are silver linings and bright lights in all of it. Let me start by offering condolences and asking us all to keep in our thoughts and prayers those who have lost loved ones over the weekend over this carnival outbreak, and those who are confined and in isolation. And we need to keep them in our thoughts and prayers, and we also need to give them as much support as possible wherever we can.
Okay. We received the dashboard last evening, but in furtherance to that, is there anything else, any changes in the numbers or so that you can share with us this morning, Minister?
No, at the moment, no. What I do want to say, though, is that although you would see positive cases for the 24 hours into Sunday as 41, please do not assume that means that's all that is there. It was a Sunday. We did have volunteer teams as well as our teams out there, and we wanted to make sure that the dashboard went out as best as possible at 8 p.m. or immediately afterwards. So there were some reports still that were not in. So those are going to be incorporated into today's figures as well. Based on our analysis and observations in the field, we are not over the hump as yet.
Okay.
We still have a significant way to go. We need everyone in the community to act in unison to fight this virus, because this virus is well coordinated and is looking for any and everywhere that it can to infiltrate our loved ones. So and to get into our communities. And one slip is all it takes for it to continue its spread.
Okay. Well, you kind of preempted my next question to you, because you noticed that 4-1 drop. It was a little alarming.
Precipitous.
So I wanted to ask, what were the factors impacting that? So here you're saying that those were results from swabs taken on which day?
That was Sunday testing. But like I said, a lot of the teams were out till late.
Right.
And their reports came in a bit late. We also did have significantly volunteer teams as well. So that coordination took a little more time, and we wanted to get that report out at 8 p.m. before individuals went to bed, so that they could see at least where we were as best as possible.
Okay, so that 4-1 from yesterday is just a small, you would say a small percentage of what the overall results for yesterday should be.
Correct.
Based on the test you took.
Yes, that is correct.
Okay. Minister, I want to ask this question. Psychological support for the medical team. Nurses, reports of nurses being overwhelmed, fatigued, burnout, if you will. How are we addressing those?
Like everything else, Brenda, as best as possible. We do have counselors on board that have been available. Access and availability varies because this is a pandemic. And appropriate access, sometimes in most cases, the most appropriate access is a face-to-face counseling. And as you would be aware, that's not necessarily always practical at this point in time. We're dealing with a pandemic that has individuals confined and for our medical personnel that are on the front line, in particular, when they finish their shift or so. In many cases, they don't, out of choice for them, of their own, or out of situations that exist in their own homes, they're unable to return home. Or even when they do, they're unable to interact with their families as they would like to. So I do think we need to recognize the toll that it is taking upon us all, but in particular, our frontline personnel, our medical personnel, our community health nurses, and now most recently, and very much a heavy load for those in the hospital, or doctors and nurses in the ICU, and the hospital in general, accident and emergency. Those areas, please, if you can spare a thought, a prayer for them as we proceed, a kind gesture or so, it would be most appreciated by them all.
All right. In terms of continuous care, Minister, for the national community, so someone with, pulmonary embolism, hypertension, chronic diabetes, all of that, going to the hospital, what is the structure now? And also, some concerns have been raised by persons who have gone to the hospital, suspecting that they had COVID, and they've used the word, when they've gotten to the EMT, they've been scorned or turned away. Can you address that?
And I didn't hear the last part. I'm hearing turned away, but turned away, are you saying from hospital or
yes,
somewhere else?
from hospital, yeah.
No, what is happening is the hospital has to do it's triage. Those at accident and emergency and department heads, they do have to do their triage. The hospital is under pressure now with respect to the number of people,
right.
And they do have to make decisions, professional decisions, as to who it's absolutely necessary for them to come into hospital,
right.
Or whether the treatment can be done at community level. They also need to make sure as best as possible that they do that screening and testing of individuals before they admit them into hospital. But remember, even with that testing and screening, we're all very much aware that this virus has an incubation period. So what makes it even harder for our healthcare providers is while they're doing a test at a certain time, we're all very much aware that 2 or 3 days later, someone who tested negative at that point could test positive immediately afterwards, and that person could, at that point, be on the ward. So we all have to be very cognizant of that, and make sure that we understand that this situation is going on at our hospitals, which is no different from what has gone on in almost every single country who has had to deal with a community spread of COVID-19, and in particular, community spread of the Delta variant.
Yeah, but we at the same time, though, we wouldn't want any members of the national community to feel that they're being scorned, because that was the word used.
Not at all, not at all. And I have been there every day to the hospital with the team that is there, seeing the service that they're providing, giving as much support as possible, as well as with our community nurses and team out there in the community. So everyone is doing their best under these most difficult circumstances.
Right. And just to address the other part of the question, COVID is not the only thing happening at the hospital. What is the structure for, folks that are having other things? So if I have pulmonary embolism and I go to the hospital, diabetes, hypertension, what's the structure now?
We have had to contract those services, so they have moved, and certain wards have been incorporated into other wards to make sure that those services continue. So it's been a planned movement that we wished to avoid, but we are in it now, and as such, those various phases of making sure that we can deal with COVID-19 patients, but at the same time, deal with our male medical, female medical, surgical, obs and gynae, and pediatrics as well. More of those primary services, but all needs for hospitalization. Our team is providing yeoman service to ensure that we are able to, as best as possible. But as I've said previously, based on the degree of outbreak, and we've our worst fears have become a reality. We have said that with a mass event or mass events like we saw over Carnival and the existence of Delta variant out there, that this would create a chaotic situation, a worst case storm for this virus, and that this would put significant pressure and inundate our health system. Now, having said that, having warned, having begged and pleaded, we are going to do what is necessary, do our best as possible to fight this off, those in the trenches, to make sure that our hospital system remains as stable as possible, to make sure that we've learned as many lessons as possible. And some of those lessons that you have learned basically say that expect this. In other words, as we are seeing, expect your hospital system to be inundated. Expect this percentage of individuals to be infected. And that if you did not get individuals to be vaccinated, expect this high level of death. And regrettably, this is what is happening. We are out there trying to mitigate, trying to avoid as best as possible anyone else coming in by offering and making sure, even during lockdown weekends, that vaccinations and testings are available as best as possible. So we will do our best, and I need everyone else out there to do their best.
All right. Minister, we know we have to let you go, so I probably won't catch you on the next go-around. Our Senators Allie and Mr. Campbell have some questions, but I cannot let you leave without asking this. And just so the doctors and the nurses at the hospital, there seemed to be some anxiety in the national community about the hospital, and people are going with this notion that everybody is mixed and this nurse is caring for the COVID patient and caring for that other patient and so on. But my question to you is, Minister, in terms of personal protective gear, equipment, that is the PPE, for the staff on the front lines, do we have enough? Do we need assistance with? Are we raising that sort of awareness where we're saying, okay, send as much as you can to us? There are groups in New York, Miami, Toronto, Trinidad, wherever Grenadians are. Is that a request that you have this morning for personal protective gear for our frontline workers?
Brenda, first off, there are two parts to that. And messages came to me from some of our frontline staff that it is very, very destabilizing and disheartening when negative messages and criticisms come out. And what they're trying to do is save lives and care for the sick under these difficult times. And then individuals who actually came into their care and were looked after are coming out and trying to discredit them. But on the flip side, they recognize that these are difficult times, and they ask for the understanding of individuals as well. With respect to what services or support we may need, many of our nurses, and some of our doctors have, by virtue of the fact that they live in the very communities where this infection is ravaging us, have come down with the virus. And as such, we are short of staff, but we have individuals pulling them and providing yeoman service, and are looking to bring other support in for our medical practitioners. With respect to PPEs and supplies, yes, at present there are currently enough. As to whether this virus goes another 6 weeks, 4 weeks, 1 week, time will tell, and that is dictated by us as a people in our very own communities, what we do to prevent its spread. That is not up to the individuals at the General Hospital. And frankly, it is not up to the individuals at the Ministry of Health who are out there in the community. It is up to us all. And as such, we need to always prepare for a worst case scenario, that this goes much further than we are able to or would like to see it go, or have predicted that it will go. And so support from our various diaspora communities out there and Friends of Grenada is always welcome, a coordinated support. So anyone who would like to offer any assistance or so, my suggestion is that they get in touch with the Ministry of Health and send an email or communicate to the Permanent Secretary, the Ministry of Health. So that email would be ps at health.gov.gd. Let me say it again, ps@health.gov.gd, so that we can coordinate a response. In some instances, it may just be to know that there are individuals out there willing to assist. And in some instances, based on the logistics and what the individuals have to offer, it would be most appreciated. We have individuals, recently I was on a conversations yesterday with some doctors, Grenadian doctors who live abroad, who are offering their services, telemedicine support for the communities, etc., to assist us, hotlines, and also giving those doctors and nurses in the general hospital telemedicine support consultation. So it depends on individuals, and there are many individuals out there in our diaspora who can make a positive difference. So there isn't a cookie cutter answer of yes or no. I think it depends on the individual's offer, that we will look at all, and all would be appreciated at this point in time.
All right, thank you.
Right, Minister. So let me first of all start off by commending yourself and your ministry for all the pop-ups we saw happening over this weekend for testing and vaccination. I think that was a good move because, in this time, in this crisis and in this wave, the issue of testing is something that comes up, and you hear a lot of, and when you look at the experience in other jurisdictions and other countries, that has been the case. So my first question, of course, to you is, are these pop-ups going to continue? And do we have what is required to keep on testing? Because the more we know of the situation of COVID and its positiveness in terms of who is infected, the better we get a grip on this.
Yes, Chris, the pop-ups or the sites for testing, as well as the sites for vaccination, will continue most definitely. It is one of the tried and tested strategies in fighting this disease. We are going to convert some of those sites this week to what we call respiratory clinics, which are going to deal with not just testing and vaccination, but some tertiary or some treatment as well. Right. For individuals who may be high risk or exhibiting symptoms. That's the community type treatment. So medications, checking persons' oxygen levels, their pressure, their sugar, etc., to find out those who have just tested positive, how high their risk level is on the onset. And the hope there is to prevent some of them ending up being our hospitalizations and deaths with an earlier intervention once they test positive.
Minister, now is a time for unification, not blaming and pointing fingers. And my question on this angle is it, I know you've constantly made a clarion call for volunteers to come in and assist where we can. How are we doing with that? I mean, I'm not going to extend it and say that retired nurses and doctors come back out because they may be at high risk. But are we seeing volunteers from SGU and other facilities that can come in, the private sector that can assist in all of these other administrative aspects that you may need? How are we doing with that volunteerism and the request for that?
Chris, we are seeing quite a lot of the pop-up sites, testing and vaccination done over the weekend were done by volunteers from St. George's University, from our Cuban contingent, and also from members of our hospital staff who during the week were in the hospital and over the weekend went out into the communities to give support to our community team that's been there since March last year, dealing with this. So we have been receiving many offers of from volunteers, but I think each and every one of us needs to recognize that we can and should be making a positive difference in this, and recognize what our strengths and talents are and offer those, whatever are based on our level of training and the sector that we represent also, and offer that assistance within either to the Ministry of Health, to the government of Grenada, or to our various communities, and make sure that we are all making a positive difference in this battle.
I am going to ask you a question to probably examine your clairvoyance on the issue going forward. Because for us in the private sector,
clairvoyance.
Yes, the minister to predict what is going to happen down the road, and a lot of us in the private sector would not like to see the country shut down. We understand the issue with livelihood and lives, How do you see it based on what your ministry is doing and all the effort that we're putting to stem this? Do you think we have to wait another 4 weeks, 6 weeks to see the results of some of the methods that we have adopted now to understand how the curve is going to flatten or dip? Where do you see us in the next 6 weeks in terms of this virus and its levels of positiveness and, of course, deaths? Because we do have a serious issue with deaths.
Yeah.
Chris, it's right now we have a positivity rate of 30%. And our assumption out there is that is an accurate assessment of the population. The 30% of our population are currently infected with COVID-19 and the Delta variant.
3 in 10.
So those 30%, if our communities don't change their behaviors and interactions, those 30% will infect individuals exponentially to a level of 7. So very quickly, we will get to that 60 or 70% if we do not, these movement days, Monday, today onwards, we have been indoors for the weekend. If we rush out and congregate and meet and greet and spend time in our rum shops, or when we are in lines that we are not respecting the 6-foot distance, that we're not wearing our masks, that we're not sanitizing, then we will see a continued spread, regardless of what we in Ministry of Health say, regardless of how many people we have out there testing or giving vaccines. We will see a continued community spread if our community does not take the necessary steps to stop the spread of this virus. Having said that, whatever actions we take, it is a 10 to 14-day period before you see the difference, before it changes, before it can be reflected in that daily dashboard that we give. So in terms of the number of new cases or so. And then after that, there is at least a 1 week to 10-day lag with respect to hospitalizations and severe illness. So we're in this at least for another 2 weeks to 21 days in terms of whatever we have started to do as a community positively. It's going to be 2 weeks before we see those figures on the dashboard reacting to our actions, and another week after that with respect to the severe illnesses and regrettably deaths as well.
And my last question to you on this round is the situation this morning. Brenda brought up the issue of convalescent homes and what is developing there in terms of the patients as well as the staffers. Is your ministry contemplating, or do your ministry see down the road that in order to protect our elderly in those homes that we may need to mandate for the staff being vaccinated, or even the inpatient, the in-house patients there as well, for them to get vaccinated? What is your views on that?
Chris, that is one of the most frustrating areas of this and disappointing areas. I personally met with managers and members of these convalescent homes and begged and pleaded with them to get vaccinated and have their staff vaccinated and their residents in their care vaccinated. I personally went to some of these homes to assist in the vaccination, to make sure that it was done, was given priority. Any home that requested the vaccinations, that they got it immediately. We begged and we pleaded. And over the last months, not only has there been an outright resistance, but there's been a level of arrogance. I'm the one being called arrogant, but look on social media, some of these individuals have proudly touted the fact that they're not vaccinated and looking after our elderly. They've proudly stated this. And this truly, truly is regrettable and is and could have been avoidable. We have our most vulnerable who definitely have not left. They're shut in and have had this disease brought to them by individuals who, frankly, I have to say it, have been irresponsible, have not heeded the warnings. They cannot say they haven't seen what has happened in Canada, in England, in the US, many other places around the world. to homes for the aged. They cannot plead that ignorance. And they really do need to step up now and try as best as possible to mitigate this.
Thank you, Minister. Byron?
Mr. Campbell?
Yeah.
We have to go out. You have
Minister,
10 minutes, Mr.
wow.
Campbell. So let's
I
do
just
that
want to
quickly.
congratulate you and our department for the services. This is an emergency, and when we had Ivan was an emergency, we reached out to our international community for various support. We never accepted our condition. Yes, we recognize that our first efforts must be ours, localized. But in this case, in this emergency, who have we reached out to and for what? Because the point is that we must never accept that we can't do better, particularly where lives are concerned. And as you have mentioned, the state of our hospital services in terms of being inundated. Because when we talk about 50 plus persons hospitalized, that's a big jump in terms of using your current staff, who's already stressed, to manage. So that question is there. The second questions I want to ask, and I think Chris touched on it a bit, what would be the specific conditions for the government to consider additional restriction of movements? Because this is the primary way in which the virus moves around and increases. So clearly there are some conditions, but what with other countries we see have and the point I want to make is that you hear a lot of recommendations and suggestions, but you are in the hot seat. You're working with a committee, with a government, with a cabinet, with science to dictate or to make decisions on what are the best measures to flatten the curve, so to speak, because you have already mentioned that we are not yet over the hump. I mean, what would bring us to a condition to increase the restrictions of movement of our population?
Byron, let me take the last question first. We have to find that balance. And we have all seen, because we all lived through it, that last year with the various restrictions on movements that were done, they created periods of no movement and then periods of excessive movement and gathering. And as such, we need to find a balance, because back then what we were dealing with was trying to prevent a cluster becoming a community spread. What we have now is community spread, and we have community spread to the level of 30% out there, so that we can assume any gathering in any community, 30% of the people there are infected. And as such, so any lineup for any supermarket, any lineup for any bank, any lineup for any hospital, any services, Western Union, whatever it be, that those lineups, 30% of the people there are infected. And also 30% of the people providing the service are quite possibly infected as well, because 30% of our community. So the balance and the actions are very different once you have a community spread. And this was what we begged and pleaded to avoid, because our ability to restrict, to act, and to get control of it is very, very different from when it was cluster outbreaks that we were trying to prevent. So that part I think we need to be aware of with respect to what other restrictions or what other actions public health officials and the government can do. On the question of assistance and support internationally or regionally, like we got during Ivan, etc. Ivan was very different because we were isolated. We were one of the few countries affected by Ivan. The rest of the world was not. Whereas with this, the entire world is under a pandemic, being affected similarly. So we saw this very early with respect to our access to vaccines. And before that, access to testing equipment. Whatever it is that we are requesting and in need of, chances are the world is also requesting and in need of. We have been doing, and I really want to compliment those who have been assisting us our procurement side, Government of Grenada, our missions abroad, St. George's University in particular, and Friends of Grenada, as well as friendly governments who have come to our assistance. We have a Pfizer vaccine here because the United States has made sure and made it accessible to the region now. So those things are helping. That's the coordination that's happening internationally. We have additional AstraZeneca because of the UK government as well. We have our access to vaccines came from a coordinated effort of the WHO and those governments and other governments giving support there. But still, there are other areas that we have to fend for ourselves. We are short on nurses and doctors, and every single country in the world similarly is short on nurses and doctors. But we are reaching out and we are looking, and we will find, if they're out there, we will have them there this week. We have a couple of initiatives. I don't want to make it public until they actually arrive and we get them here, but we do have some initiatives to get some more support, particularly ICU nurses, to give those of our nurses and doctors who are providing that yeoman service, give them additional support there. So we are doing those things, but in general, the things we need are the things that everybody needs, and we are competing like everybody else for those scarce resources. But so far, we are doing as best as possible, but we just need to recognize that these are difficult times.
Are you taking any technical advice, professional advice from the WHO or PAHO? Are there any protocol standards, particularly in a situation, so in terms of how we balance the protocols and the measures in particular from these regional and international organizations in the decision-making process?
Byron, most definitely. Up to Thursday, we had sessions with Pan American Health Organization, speaking directly with their executive and their senior technicians, scientists, public health officials. We get daily communication to our regional offices of Pan American Health Organization, as well as weekly communication through Pan American Health and directly to WHO. We're also in contact on a regular basis with other first world governments and their public health officials.
Thank you.
And then, Byron, not to mention, I can't not mention the support that we get from CARFA, as well our own public health officials, CARFA, as well as our OECS help desk, who, by the way, CARFA is, OECS help desk, is run by a Grenadian, Dr. Carleen Radix, and we need to be proud that Pan American Health Organization for the entire region is run by a Dominican, Dr. Carissa Etienne. So we're in good company, and we have our family, our neighbors in these positions.
Thank you.
Thank you, Minister. I know we have to let you go as you.
I'm going to take yes.
Yeah.
But I do.
You could take one more. You could take one more.
I do look forward to a time when we are a different topic to discuss.
I have one more for you, though.
That time is not yet upon us.
Right.
So I have to appreciate any moment that I get to discuss and to communicate to our public.
Yeah.
And it is through that communication, I think, and I really want to thank you for the opportunity to communicate to our public so that we can hopefully get past this. One of the best tools is communication.
Right.
Communication,
indeed.
vaccination, and social protocols.
I must slip in one more before I let you go, though. I mean, traditionally and socially, we raise to really respect the dead, say goodbye to the dead. We have these rituals, we have these connections that we have to our people and people who are sick. And we know that COVID kind of restricts how people go to hospital, and so is any consideration being given to, let's say, if someone is kind of slipping out, that, let's say, a video call can be made from their bedside to their family, or in terms, if my husband died, I don't have a husband, so this is just a scenario. If my husband passed from COVID, and I wanted to attend the funeral, do what I needed to do. Can I arrange with the funeral agency for a hazmat suit or something? I'm just raising that scenario, Minister, because it is a real struggle for us as Grenadians, being so accustomed to treating with our ill and treating with our dead in a particular way, and having to adjust to this very cold and fierce impact of COVID on that, how that is impacting us, and just how we can kind of, try to make it a little easier. I guess that's my question, really.
Yeah, Brenda, yes, that is a very good and difficult question. We are not any different to any society in the world. I think every single society in this world holds their loved ones in high esteem and needs to mourn when there is the unfortunate passing of a loved one. With respect to COVID-19 and how COVID-19 affects our vulnerable and those who are in hospital, in most cases, the last hours or last day or so are with ventilator and where individuals are not able to communicate or not conscious. But communications, yes, have been facilitated as best as possible under these difficult times, trying times, and we will continue to, as best as possible, facilitate that.
Okay.
That has to be done in a controlled manner that it doesn't affect the care of that individual or any of the others around that individual, and to ensure that it also does not affect the loved one, the others next to. So one of the difficult challenges is plugging in of chargers. And plugging in of chargers on a system where oxygen and other vital machinery are plugged in.
Right.
So those are some of the challenges, but they're not impossibilities.
Okay.
With respect to attendance and being able to attend funerals, I have to leave it to the team there and the stakeholders. Our undertakers cannot be put at undue risk either. Mm-hmm. And they have got to follow certain protocols. They have families as well. They've got to make sure that they keep themselves safe. They have, most if not all of them, have been part of our society for years, and in fact, in most cases, generations. Right. And they're very much aware of our need to mourn, but they're also very much aware of the risk posed by this disease. Okay. And they will find the balance as best as possible, and we will give them the support from the public health standpoint to do so.
All right. Thank you, Minister. That's it from us this morning. Any parting words for the Grenadian community?
Thank you, Minister.
Just final words, just let me say it. Let us continue to keep in our thoughts and prayers those who have lost loved ones, and those who have right now loved ones and themselves dealing with COVID-19. It is not an easy disease. The symptoms and the trials and tribulations that many of our population, we've all been going through difficult times, but those who have tested positive and are exhibiting symptoms, in some cases, are really going through a difficult time, and we need to keep them in our thoughts and prayers. And finally, please, those of you who are not positive and have not yet taken the vaccine, please come out and get vaccinated.
All right. Thank you, Minister Steele. Continue to stay safe, and we look forward to seeing you again next Monday morning.
Thank you.
Gentlemen?
Yeah, well, Brenda, I think as we wrap up, I just want to extend the same plea that the Minister gave to us Grenadians who are not yet positive and who are not yet vaccinated. You know, in the private sector, we say the 3 W's. Wear your mask, wash your hands, watch your distance, and please get vaccinated so to help the situation of being severely ill and possibly dying. And you know, finally, I just want to say the whole issue of pleading to our Grenadian brothers and sisters. I want to give an example of a situation I was given recently where we had a business ventures having a situation where they had workers in 2 groups separated in order to protect intermingling. And then here on the weekend, these 2 groups end up in a rum shop. The 2 groups together, drinking and having fun. Nobody following the protocols. One person in that group was positive. It took out the entire 2 groups, which we're talking about 20 plus people being taken out. And that is a good example of how we need to be careful about our behavior and what we do as we go forward. This is not a joke. This is something that we all have to deal with. And it's not only about positive cases. It is about those who have to be isolated as a result of direct contact that takes us out and the effects on business as we go forward. So that would be my final words.
Yeah. Thanks for that, Senator Allie. Mr. Campbell?
I'm lost for words here for a moment. What we have to keep in mind here is what the minister said, 30%, 30%, 30%,
That's 3 in 10, right?
of us
3 in 10.
all
That's 3 in 10 people, right?
Yeah, 3 in 10. It's about the same numbers, 3 in 10 that die when they go to hospital. So keep that in mind. Those numbers are easy to remember. So it means that, and the other thing that comes here is that these numbers are expected to grow, meaning that more infections, more deaths, and keep in mind that this is an emergency. It's an emergency. It's not normal times. That we have to use all the measures. Vaccination is one of the. It is demonstrated everywhere that it helps. It helps with preventing you from getting very sick, preventing you from getting hospitalized. In other words, it is several times. I have the number somewhere. Several times you're more likely to get very sick or end up in hospital if you're not vaccinated. So this is, in other words, and keep in mind that the virus is going to be with us for a long time, indefinitely. We don't know. So getting vaccinated now is going to help us down the road, down the stream, in the medium term, the long term. So it's an important measure. And besides, immediately restricting your movements when necessary, and come in contact with persons only if it's necessary. So we all in this together. It's not about blaming. We have to take individual and personal responsibility for ourselves and those around us, and by extension, the community of Grenada. So I just want to put that appeal out, and please, colleagues.
Thanks, Mr. Campbell. Thank you so very much. Thank you for that impassioned plea from both of you gentlemen. That's it for our program this morning. This has been Perspective. And thank you all of you who joined us across the various platforms. Again, thank you to MTV On Air Online, Mikey Live, TNR Communications, Partygrenada. Of course, we welcomed the KG9 this morning. Yeah, forgot to mention KG9 at the top. We welcome KG9 to our viewing audience. Thank you so very much, everyone. And those of you on Sister Isle in Carriacou, thank you. To the Honorable Nickolas Steele, our Minister for Health, again, we thank you for giving us the Monday update and just the way things are progressing. To all our frontline workers, volunteers, everyone who's coping, and there are some folks who are saying goodbye to those who have passed from COVID this week. We extend our love, our sympathies, and our well wishes to those of you who are afflicted or affected in some way. Stay positive, everyone. Try your best to stay positive, but guess what? Remain negative. Remain negative from COVID. I'm Brenda Baptiste for all of us here at Perspective. Richie Oliver and everyone else, our executive producer. Goodbye. Whew, this was a heavy one.
These heavy ones.